Hi, everybody. Thank you for joining us. We're going to talk about the Pregnancy Workers Fairness Act again today. The scenario is Sarah as a customer service representative and is at a large retail chain. She's currently 6 months pregnant and has problems with her back pain and is getting tired. Her job requires her to stand long hours, sometimes for her entire shift. And she has to frequently lift packages weighing up to 20 pounds. She hasn't requested any accommodations yet, but she mentioned to her supervisor in casual conversation that she's feeling exhausted by the end of each day and having trouble with the lifting requirements. Well, now this is a scenario, everybody. So these are presented to us this way, and we genericize them. But as soon as Sarah casually mentioned to her supervisor that she was having trouble with lifting requirements and she's exhausted, that is an accommodation request. There is nothing else that has to be said, no special words that need to be used. If you have a pregnant female and you are observing them having challenges, it is your responsibility to confirm if there's anything that you can help them with. And that could be that simple. Can I help you? And if they say yes, document what they need, provide it as quickly as you can. And if they say no, document that also, but let them know that if there's anything they need, they should let you know. Now, Sarah's supervisor, John, didn't know what to do. He didn't know how to respond to Sarah saying, I'm having challenges. He's noticed she's having problems with productivity and she's impacting other employees. They're having to cover her tasks. She's having performance issues. He's concerned about the impact on the team, but he's the operations person getting the work done, or the manager or the supervisor or the team leader. He may not be the individual in the organization who has even heard of the word Pregnancy Workers Fairness Act. So what we're doing now, everybody, is really top-down information and informing the employee who's pregnant. Let's make sure we're very, very proactive with them so they feel comfortable, not impacted, not feeling like they're doing the wrong thing if they ask for help. Well before it gets to the point that a supervisor is getting impacted by the operations because somebody's not being able to pull their full weight because, in fact, they're pregnant, which is what the Pregnancy Workers Fairness Act is for. We don't mess with pregnant women. So 2 weeks later, this is after she had already let them know informally, she now submits a formal request. She needs additional breaks. She wants to sit down and rest during her shifts. She's also requesting not to lift anything over 10 pounds for the remainder of her pregnancy. Now, John is still unsure whether the company has to provide these accommodations or how to balance Sarah's needs with the demands of the workplace. But my first question is John the person she should be speaking with at this point, or should she be speaking with somebody who understands the American with Disabilities Act, understands workplace injuries, understands pregnancy-related challenges, understands the Family Medical Leave Act, and understands how these all work together to make sure employees are not impacted, discriminated against, harassed, or feeling retaliated against because they brought up a need for a medical reason. This happens to the Pregnancy Workers Fairness Act, but the methodology with way you approach these issues does not change between ADA and Pregnancy Workers Fairness Act, except for to say, at this point, if there's any part of Sarah's job she can't do, we're looking at leave as an accommodation, unless that would be an undue hardship. And because this is a retail chain, I'm making some assumptions that we might be able to bring in temporary workers in a more easier manner than something that was a more complex job that required significant training to be able to perform the functions. But when we're talking about something that we are looking for, an employee who can perform some of the functions, but not all, we're going to accommodate the functions that she could perform. Could we get her a chair so she could sit where she is standing normally in a seat that is appropriate for the environment during her shifts? Can we have her not lift over 10 pounds and have someone whose job is to be able to call to the space when we need an extra weight? Or is that going to be a problem at times of days where it's too busy and they have to move things through quickly? Maybe there are different shifts that could work. So the idea is to really engage. That's the interactive discussion. That's the good faith meeting. Sarah, tell us, how do you think we could help you? What do you think would work? Let's ask her. But again, is it John who's doing this, or is this an HR person who is trained on how to implement the ADA accommodation blueprint and knows how to accommodate and knows how to identify when something might be considered an undue hardship and knows how to go to the next step and evaluate and analyze and document if in fact there is objective to say that these pieces of the job would be an undue hardship to an accommodate, and what we'd like to do is give you leave instead. Do remember, everybody, when you're providing leave around the country, not everybody has money to pay themselves when they're on leave if they use up their benefits, and there's no state benefit to pay them. This is where it gets challenging. And that's why we're trying to keep our employees working in the job with an accommodation if we can. And now for pregnant employees, we're going to keep you working at whatever functions of that job you can perform, and then we'll provide you leave as an accommodation if in fact you can't perform all of them, if it's not an undue hardship. He's worried about creating resentment about the other employees by making them step in and have to do her job, especially if it's about to be the busy season. So what are some of the challenges? Hopefully John is going to go to talk to HR, and John is not going to try and handle this himself. And when they approach you, you'll be looking at getting in temporary workers or maybe even extra people to help lift things, because maybe a lot of the other people in that position could use some help with the lifting to keep the busy packages moving through the retail store. So I hope this is helpful, gives you a different way to look at these regulations. Remember that if in fact she has a serious health condition that meets the criteria of FMLA, you'd be running FMLA concurrently to the pregnancy leave for the Pregnancy Workers Fairness Act. But if the only reason she's not working is because you can't accommodate her, then that's not really FMLA, is it? So be very careful that you understand when FMLA should or should not run concurrently, because the eligibility for FMLA is met. Hope that helps everybody. Thank you for joining us.